So when people are in accidents, and then you find that most of the time they suffer some of these conditions.
Yes.
So apart from accidents, what other causes would there be for these kinds of
sitting improperly, picking up things improperly, lifting heavy weight, extra heavy weight, and possibly pulling something. Sometimes it could just be sleeping improperly, not exercising. You know, in fact, there's 3 types of stresses. In fact, the simple answer to that is stress. And there's 3 types of stresses. There's physical, there's chemical, and there's emotional stress. Physical stress could be the way we sit, the way we sleep, the way we pick up things, a fall we may have had, the birthing process. In fact, the first subluxation to possibly occur in the body could have happened during the birthing process. And the reason why is because the doctor or the midwife, he or she may pull the baby's head out of the mother's womb, turn the baby's head 180 degrees to one side, plop the shoulder out, and do the same thing to the other side. If he can't do that, he or she can't do that, they may use forceps and yank the baby's head out, or use a vacuum and suck the baby's head out. All these things could cause trauma to that newborn baby. But then as the child gets older, he or she may learn how to crawl. And what happened? They fall. They learn how to stand. They fall. Walking. They fall. They have brothers and sisters that play and push each other down. All these different things could affect that child later on in life, and we don't think about those little small ka-kra-ka-kra, few, VVV, ka-dun, small falls, but it piles up over time, and as it piles up over and over and over again, it can affect you negatively. And it's, you know, it could be small. You know, some symptoms a person could have, or some things that people may have and they may not know about. They may not have pains per se.
So pain is not always a symptom.
Pain is not always a symptom. That's one of the symptoms, but it could be weaknesses. It could be the bottom of your shoe has deteriorated a little bit. It could be the one shoulder's higher than the other. It could be that your head is tilted to one side. You may have cracking sounds in your body. You know, those are just examples. Now, you know, if we weren't supposed to have this social distancing thing right now, I would do an example where I would show you how some people are weak in the hands, and because they're weak in the hands, that's letting me know that possibly they may have weaknesses in their neck, their shoulders, the arms, and after an adjustment, it could be even the way they're thinking. That's an emotional stress that's causing issues. Because I've had people that's come to the office, as I'm adjusting them, they're feeling better as far as the rest of their body is concerned, but when I do this test, they're weak. And after doing different types of tests, I realized that it's not necessarily a physical problem. It's an emotional problem. And we take care of that as well through the adjustments and through other things as well.